I've forgotten what I just asked. Okay. You got the filter on, right? Okay,
Yeah, oh,
okay,
thank God. It's been a long day.
G'day everyone, I'm Dr. Brian Tan, Chief Health Officer for Salesforce APAC, and I'm joined by Seb Addams, the one and only. Seb, thank you for joining us today.
No problem, thanks for having me.
For those in the audience who don't know you yet, I know you're very famous and you're big here around the traps, but would you like to explain who you are and the organisation you work for in your role?
Yeah, sure. So my name's Seb Addams. I'm the head of Connected Care at Calvary Healthcare. We are a national healthcare organisation. We've got about 17,500 staff. We've got over 700 volunteers. We operate in 57 different residential aged cares,
Wow.
13 hospitals, and a national home care business as well.
So
we're very busy.
You're very busy. You're an
Yeah.
organisation that it sounds like spans the gamut of health and care.
Absolutely.
From acute care, primary care, community care,
Yeah.
aged care, disability, hospitals, etc. So
We've got it all.
with that broad scope of the work that Calvary is doing, what are the most exciting parts of that experience dealing with people across that continuum of care?
I think it's really the challenge that it presents. So there isn't really another industry, in my opinion, that is more challenging than healthcare, and I do love a challenge. So it's really kind of listening and understanding to people, what they're going through, the challenges that they face, what can we do to be able to address them, give them time back in their day when it comes down to clinicians, and make sure patients, residents, and clients are really heard. And we react to that, and we provide them the best possible care that we can, where they're at.
Yeah, that sounds great. And so you mentioned there in that one breath, both the experience of the clients and patients that you're serving, but also your staff members as
Yeah.
well, it sounds like.
Yeah.
So what drew you to this work personally? What excited you about the ability to work with people across that spectrum and also the staff that you're working with?
Yes.
Tell us a bit about the culture as well.
Yeah, so I think with this, it's always the challenge that comes from it. So if you've ever been a patient in a hospital and you understand exactly what that's like from
Yeah.
that side of the fence,
Yeah.
and then when you actually walk in the shoes of people that actually do that job, it's very different in terms of when you look at it, and it gives you a renewed respect as to exactly what people go through and the amount of administration that clinicians go through. We waste 20 to 30% on administrative tasks.
So true.
For someone like me that loves optimization and building in better processes, I want to cut all that out. I want to try and optimize as much as I possibly can and really give time back to clinicians so they can spend it where they want to, and that's to be with the people they're caring for.
I love the sound of that as a clinician. We talk about bringing joy back to the day job.
Yes.
And so the tech systems really need to just help you enjoy your job. Take the clutter out of the work,
Yeah.
reduce the noise, and really help you have those insights that really get your blood boiling on the
right.
job, make you excited. So your role as the head of Connected Care, can you explain a little bit to the audience about what that entails?
Yeah, sure.
Yeah.
So I'm in a very lucky position in my role. So we started off with home care and being able to see what the challenges are and addressing those using technology like Salesforce to be able to increase the productivity that exists there. But now comes the challenge. Because we are across all of our hospitals, our aged care facilities, independent living units, and home care as well, how do we join those dots together?
Yes.
How do we ensure that we have a unified client profile where we can meet the person where they're at in their healthcare journey and to really be able to provide the care as and when they need it, where appropriate? So for me, that's a really exciting prospect. And we know all of that information is not just going to live in Salesforce.
Yes.
We know that we have
Yes.
other systems that are going to hold and store that data.
Yes.
And the privilege that I get is to really to be able to define those systems and then see how do I join the dots together,
Yeah.
and how can I represent that data to
Yeah.
something that's meaningful, not only to us as an organisation, but also to the person that's receiving the care.
So, Seb, you describe your job as being at the conjunction of really tech and care,
Yes.
working out what systems are involved and also what the processes should be to enable best value care and the highest quality care. Can you paint a picture for our audience about, on a day-to-day basis, what your job constitutes then? How do you do all of that? Because that sounds like a highly complex problem.
It's a really complex problem to be able to have, and you're traversing clinicians, you're traversing support workers, and you've also got to keep your eye on what we're doing with the consumers and the patients and the clients as well.
Right.
So the best way in which I deal with it is understanding the problem in depth.
Okay.
Asking the 5 whys. Why do we do things the way we do? And also going on road trips with people, stepping into those processes that these people do on a daily basis,
Right.
and really be able to engage what they do, why they do it, and for them to be able to help us to explain exactly what happens. So I'm in a very lucky and privileged position to be able to go on the journey, and I get to learn an awful lot
Yes.
at the same time. So it's an awesome job.
It sounds awesome. I know I'm frequently asking myself, why am I here? That's my why question. But the complexity as well is at a microcosmic level in your day job.
Yes.
But then what kind of complexity are you seeing across Calvary as well as you're undergoing this kind of change?
Yeah, I think we've got lots of complexity that exists in terms of different funding models, different regulations that come across here,
Yeah.
the funding streams and the disparate systems that we have. We've got clinical elements of burden that kind of sit there as well that
Yeah.
we're just trying to remove. So these types of things present real challenges in terms of how we deal with our different business lines and how do we solve for it as well. And we alone in technology are not going to solve this problem. We need to partner with the business. We need to understand their challenges and exactly what they're thinking. What do they want to do? How do they want to run their business? And then the tech will come in as the underlay and to be able to support them to be able to do what they're looking to achieve.
I think one of the exciting things is you're engaging them with that conversation is also the opportunity for them to rethink the way they're working.
Yeah.
But there are some pressures that are time sensitive as well, right?
Yes.
You're working in aged care. There's obviously the Royal Commission changes.
Yes.
So there are needs to provide a platform from a technology perspective that can meet that. How are you using Salesforce to help you with that kind of rapid change that's required in that where the regulatory compliance changes are happening so quickly, for example?
Yeah, I guess the benefit that we have from the Salesforce platform is that it is highly scalable.
Yeah.
It's highly malleable from that perspective as well. We've laid our foundations and now we're able to be able to change and innovate with that as well. So as and when changes come on board, from the department or whoever it may be, we're able to quickly be able to adapt to them. That's not to say that they are complex changes, they generally always are.
Yeah.
But my team are always up for a challenge in being able to solve these things for the benefit of our clients, patients and residents.
Yeah, and hopefully we're supporting you on the Salesforce side with
Absolutely.
enough Lego shapes of different sizes as well to meet that need. You did have a choice at one time. It was a choice between
did.
Salesforce and another platform.
It was.
Why did you choose Salesforce for such a complex problem as well?
I think for the decision making that went into that, we had to understand exactly who did we want to be within that technology space. Did we want to be a dev shop? Or did we want to be an enabler of technology that is going to support our business as we move forward? And it was really the latter.
Okay.
The technology aspect that kind of sits behind in what we're trying to achieve to be able to support our business is obviously a big part of this as well. Low-code technology enables us to be able to get to where we want to be faster, and the level of complexity that's there, we can still build that in if we needed to through using Apex coding as well. Ultimately, the feature set that exists with Salesforce and the roadmaps and the investment in healthcare as well is undeniable. And that's something that really, really resonates with us and we're very excited about.
Yeah, we're excited too to be partnering with you on this journey.
Yeah.
Because and all of organization transformation is the very stuff the meaty stuff that we want to get our teeth into as well. So you've been on this journey now for I think 12, 18 months.
Yes.
How have things evolved since you have gone on this journey of implementing Salesforce?
Yeah, so it was a tricky journey to go on, as is all digital transformation.
Yes.
We start with the business processes, we reimagine them into something more, and then we apply the technology underneath for the underlay to be able to support it. So it's a really tricky journey to be on. You'll have your ups, you'll have your downs with it. You'll have people that you need to bring on the journey multiple times, and that's okay. Because by doing that, it helps reinforce your commitment back into the technology and what you're doing as well. So it's challenging, but it's one of the reasons why I get out of bed every single day.
Oh, that's brilliant. That's beautiful. That's beautiful. and that and an element of masochism as well. You love the pain. You love the pain. That's right. Any of us who've worked in healthcare for a period of time have a little bit of that. In terms of that change, you said you sequenced it as well, identifying what those priorities were, what those foundations need to be laid in order to reimagine those workflows. What were some of those pillars of your business that you wanted to focus on in particular?
Yeah, so we looked at all the elements that make up home care overall. So we've got intake functions, we've got scheduling functions, we've got care management and care leads across there as well. So it's really taking each persona in isolation to begin with. What are they doing? How are they working? How do they want to work? And then where do they intersect with other personas and being able to build that bigger picture? You start with kind of the art of what is possible, and then you kind of get a little bit real in terms of, well, this is what we can deliver, this is what we can do, and then this is what we can deliver in the future as well. Using roadmap that comes from technology, and also understanding where the business wants to go as we grow and evolve.
Absolutely, yeah. And that must have been hard work, hard yakka, because you're herding the cats across many different business teams, clinical teams, as you point out. Running a technology transformation across hospitals, aged care facilities, support at home, with clinical staff, care workers, patients, and regulators now all involved. How are you bringing people along that journey? Because it's a maturity journey as well. How are you bringing people along that cultural shift and that change in mindset?
Yeah, absolutely is. And you know, the goal behind that is really to kind of, again, meet people where they are, go through all their pain points. You know, if you can fix something for somebody and it resolves that level of pain, you know, it's worth its weight in gold. So really being able to understand what those trigger points are, understand how you as a technology professional can assist them and resolve those pain points, that goes a long way. Being able to reinforce the message of what you're trying to do and the wider vision is very powerful. And as a mission-based organization, a lot of people, majority of people, are all there for the mission at the end of the day. We want to be able to see as many clients, to be able to serve as many people as we possibly can, and provide great connected care. And that's what it's all about for us.
I love that for-purpose attitude and culture as well. It's fantastic to see. You see that in the way your staff are interacting with each other. Everyone's zeroed in on making the best of their systems that they have for the benefit of the client that they're serving. So I love that culture. There are many people on different parts of that journey.
Yes.
Some not as advanced as you are.
Yeah.
What would you give as advice to those organizations who are just beginning this journey on rethinking their workflows, rethinking their client engagement, having that single view of a customer or a client across their lines of business? What would be some bits of advice you would give them?
I would say is start with your clinicians, or start wherever the work begins, essentially. Talk to them in general terms, have a conversation, go for a coffee, walk inside their shoes as to what they do on a daily basis, do the ride-alongs with them, have a full understanding as to, again, those pain points. You know, what are they going through? Why is the work difficult? Is it from a clinical perspective that it's hard, or is it from the administration burden which they're forced to carry as well? So it's really a full understanding as to what is the problem you are trying to solve at the end of the day. How can you help? How can you bring technology to the forefront that is going to make their life easier, and in turn help our patients, residents and clients at the same time? And to note, when you do any digital transformation, there are going to be many ups and downs with this. You are not going to get it right all of the time. But when you don't get it right, you learn so much from that as well. So try not to be defeatist in that. Grab the ball by the horns, as it were, and run with it, because you learn so much, and you learn what you can do, and then perhaps what you should stay away from as well.
It sounds like wise words. It looks like your experience really has built you into a true guru of change. We're going to have to start calling you Guru Seb from now on. And as we look towards the very near future, with the use of AI to assist in the piece, AI is changing all the time. We used to have predictive AI that essentially, calculated the mathematical probability in terms of the distance between 2 points. So we're using radiology, embryology, and things like that. That's been around for a while.
Yeah.
Now we're moving to generative AI, and then agentic AI, and future robotic AI as well. Yes. How is Calvary approaching that new frontier of AI?
Yeah, so this is a really interesting point for us in a highly regulated industry. We have to be a little bit careful about what we do and how we do it. So we're going to start on the back end first. How can we optimize people's work lives where they're at the moment? So really increasing the efficiency as to what they're doing. But then looking at things like Service Cloud Voice with Amazon Connect. So understanding that you can have an AI agent which is listening to the call, can help provide relevant information at that moment in time, steer the conversation, be able to gain real-time sentiment analysis as to how that call is going, and then summarize it at the end. And that is just one sneak peek into some of the things that we're looking at the moment that we are really excited about, to be able to change the way in which we deal with clients, but not only clients, their families and their friends as well. So it's going to be pretty awesome to see what the technology can do and about the way in which we want to embrace and adopt it.
Yeah, that's truly exciting. The ability to use AI is something that's super exciting in the near future. What kind of challenges do you foresee in terms of your workforce change in embracing AI? Are they ready for it?
I think the workforce challenge that exists with it, we have many workforce challenges already, and this is kind of bringing another dimension to it.
Yeah.
But ultimately, if you're resolving a problem that people are facing in their day-to-day life, I don't think you're going to get too many arguments from people. If there's another perspective that you can put on it, and in our case, that's spending more time with the client, patient, or resident, then they're going to lap that up. That's why they do what they do at the end of the day. They're not there to sit behind a computer and type 8 hours into Salesforce or into a spreadsheet. And they're there to go and help people. They want to have that connection with people and to be able to provide the best quality of life they can to the people that they're looking after.
It's probably revisits the same principles you spoke about earlier in terms of providing those quick wins early.
Yes.
So that people are enamored with the technology and understand the value of it in solving some real pain points in their day job. Yeah.
Yeah, 100%. And I think you kind of jump on the bandwagon a little bit with this as well. So you solve one particular pain point and you're able to do it relatively quickly, and then the world opens up, and then everybody's eyes open up. It's like, well, what else can we do if we've just been able to crack this one?
Yes.
So it starts a really deep, good conversation with a lot of people in terms of, okay, so where do we go next? And sometimes it's about quelling that excitement a little bit and going, okay, let's take a step back. We just need to figure out exactly, let's get this one confirmed, what's next for us and what makes more sense for us to be able to delve into.
Oh, when you get a clinician excited about tech, there's no stopping them. That's right. Seb, thank you so much for your time.
No problem, thank you.
Thank you for all the wisdom that you've shared, Guru. Through your journey, you've definitely learned a lot, and I'm sure the organization is also profiting from the journey as well.
Yes.
With every journey, it begins with a first step, and you guys have taken more than the first step as well. So we're truly excited. Thank you for partnering with Salesforce in this piece. We're really excited to support you in this change as well. Thank you, Seb.
Thanks, Ryan, appreciate it.